oxygen administration. Okay, so oxygen administration is procedure that is done to the patients who have difficulties in breathing. Some patients have low saturation when we check the SpO2. Okay, so this is the oxygen cylinder. This is the oxygen cylinder which has a gauge. So this gauge is the one that shows us the amount of oxygen that is in a cylinder to know that there is oxygen. And this is a flow meter that will show us the amount of oxygen that will be given to the patient. Okay, and this is a humidifier which humidifies the oxygen before it's administered to the patient. And this is an adjusting knob. All right, so what I'll do now, I need to talk to the patient. Good afternoon, madam. Okay, I'm student number 2. I've been assigned to administer oxygen to you since the oxygen saturation is low. Permission to go ahead. Is there anything that I can do within the hospital? All right, so I'm going to prepare. I'll be back. Okay, so when you go to prepare, there are some things that you need to use. So we are going to use to administer this oxygen using an oxygen catheter, the nasoprom. Okay, you also need some water for testing. Okay, you also need a pair of gloves and some orange sticks. Okay, so now I'm going to wash my hands. So I've washed my hands. Okay, so now I'm going to don my gloves. After donning my gloves, I'm going to inspect the patient's nostrils. Okay, from there I'm going to get an orange stick with a sodium bicarbonate used to clean the nostrils, the patient's nostrils. So I'm going to clean the nostrils. Okay, after cleaning the nostrils, I'll get the nasal catheter. Which I'm going to connect to the patient. Okay, so I'm going to connect it to the humidifier. So before I connect this to the patient, I need to switch on the adjusting knob. Okay, so the doctor has ordered that to administer oxygen at 4 liters. Okay, so now the evidence that the oxygen is there and is open is the bubbles that are here. You see something which will be boiling. So now we are going to test if the oxygen is passing. So we are going to test. So here are the bubbles. It means that this tube is patterned. All right. Then after that, we are supposed to wipe the excess water. After wiping the excess water, we are going to administer the oxygen to the patient. Okay. Okay, just be comfortable. Okay, so that's the oxygen that we have administered to the patient. Okay, so we have administered the oxygen to the patient. Madam, how are you feeling now? Are you feeling much better? Okay, so the patient has confirmed that she is feeling much better. If the saturations were low, you need to get a pulse oximeter and check the oxygen saturation. After that, you need to go and discard whatever that you were using. Then report to the sister in charge. So until next time, bye-bye.